First of all, I would like to wish you all a very happy New Year 2020. I am Dr. Praveen Kumar Etta, consultant nephrologist, kidney transplant physician at Virinchi Hospital, Banjarahills, Hyderabad. Today, we discuss on topic nephrotic syndrome in patients with kidney disease. So, what is meant by nephrotic syndrome? So, you might have heard this word in newspapers and other media. Nephrotic syndrome is nothing but where it's a condition where there is excessive loss of protein in the urine, and there are several kidney diseases can cause this form of kidney syndrome that is called nephrotic syndrome. It is characterized by because of excessive loss of protein loss in the urine. It can lead to the reduced levels of protein, that is albumin, in the blood. So these patients, they have hypoalbuminemia. That means that is associated with reduced levels of albumin levels, that is protein levels in the blood, which leads to swelling of body. This swelling usually starts with face and then legs, then usually the whole body. And this whole body swelling is called an edema and anasarca. And when there is loss of protein in the urine, these patients, they are at risk of going into the malnutrition state because of loss of proteins in the urine. Normally, our kidneys, we have two kidneys in human beings, and inside the cross section of kidneys, we have several small blood vessels, which are called as glomerular capillaries. When these glomeruli, normally these glomeruli, normal human beings, they filter the blood. They excrete the nitrogenous waste products from the blood, but they retain the proteins, that is albumin, which is useful for the body. And when these glomeruli, they get damaged because of various reasons, these glomerular capillaries get damaged, and because of that, there is loss of protein, which is a useful substance for the body, and there is loss of this protein into the urine from the blood. This leakage of protein into the urine is called as proteinuria. And when there is excessive loss of protein above a certain degree, usually it is called as more than 3 gram loss of protein in the urine per day. These group of patients are categorized as nephrotic syndrome. And usually these patients, because of excessive loss of protein in the urine, our liver try to compensate it by synthesizing excessive protein in the body. And at the same time, there is also excessive production of cholesterol in the body. So these patients, they also have excessive cholesterol and triglyceride levels in the blood. And because of loss of proteins in the urine, there is also there is also loss of anticoagulant proteins, which are helpful to prevent blood clotting in the blood vessels. So because of loss of these anticoagulant proteins, these nephrotic syndrome patients, they are also at risk of hypercoagulability. That means excessive blood clotting in the blood vessels, which is characterized usually by the deep vein thrombosis. So that is one more complication. And these patients, they are also at risk of infections because of loss of useful proteins, including the defensive mechanism proteins. They are also lost in the urine. So they are also at risk of various infections. So various causes can cause nephrotic syndrome, and this nephrotic syndrome can affect any individual from the age of even 1 year age to the very elderly age group. And many diseases can cause nephrotic syndrome. In adults, most commonly, it is because of the diabetes affecting the kidney, leading to the diabetic kidney disease, which is also called as diabetic nephropathy. And they have excessive loss of protein in the urine. And the other diseases like even uncontrolled hypertension and specific diseases like SLE, that is systemic lupus erythematosus, amyloidosis, can all cause these forms of kidney disease characterized by nephrotic syndrome. And in children, specific diseases like MCD, that is called as minimal change disease, and FSGS, that is called as focal segmental glomerulosclerosis. These are the two important causes of nephrotic syndrome in children. And membranous nephropathy is also a similar type of disease, but it occurs in adults. And many forms of nephrotic syndrome, they are diagnosed specifically by renal biopsy. Renal biopsy means biopsy is nothing but is a tissue sample taken from any organ for microscopic examination. That is called as biopsy. So kidney biopsy means it is a procedure where we remove a small piece of kidney and send for microscopic testing. Thereby, we diagnose specific diseases which can cause kidney damage or kidney failure. So when this nephrotic syndrome, initially, if we identify the disease and if we take proper treatment at correct time, most of these diseases get controlled, and some diseases they can be cured also. But if we neglect these diseases at initial stages, it will lead to the progression of further kidney damage. And once the progression happens, usually these kidney diseases they are usually irreversible. But even at this stage also, if you take treatment, you can prevent further progression of kidney damage. You may not reverse, you may not cure the kidney disease, but at least you can prevent further progression of kidney disease. That is also one more aim of the treatment of this nephrotic syndrome. And when the kidney disease is much more advanced, like when the kidney function loss by about 90% of the total function, usually these patients they require some form of renal replacement therapy, either in the form of dialysis or kidney transplantation. That is also in advanced stages. So kidney disease should not be neglected. We have to take proper treatment at correct time to get cured from the disease. And regarding the complications of nephrotic syndrome, I have explained you regarding malnutrition, infections, and also increased risk of hypercoagulability, that is increased risk of deep vein thrombosis in these patients. And regarding the biopsy is usually not required in children, usually less than 10 years of age, because most of these children with nephrotic syndrome, they usually have underlying minimal change disease. So it is not required for the biopsy to do in all these cases. So most of these patients are treated empirically with steroids. So most of them, they respond to steroids even if we start treatment empirically without knowing the exact disease on biopsy. But if some patients or some children, like around 20 to 30% of children, they may not respond to these empirical steroids without doing biopsy. So for these cases, we need to do again renal biopsy to establish the underlying cause, because underlying cause or underlying the disease will tell you the prognosis of the patient and the future course of the patient, whether this patient will go into further progression of kidney disease or it will go into remission, that is the disappearance of proteinuria in future, or response to therapy is also determined by the underlying disease. So it is especially important to know the underlying disease causing the nephrotic syndrome. And in adults, especially the diabetic patients who are having proteinuria, usually there is no need of biopsy in majority of the cases, because it is because of the underlying diabetes causing the kidney disease, usually the nephrotic syndrome develops. But we try to see the other evidence of any end organ damage because of diabetes mellitus. Like we usually see the retinal findings, whether there is any evidence of retinopathy because of diabetes. If there is associated retinopathy, we usually try to avoid the biopsy, because it indirectly tells us that when there is associated retinopathy, the kidney problem or the protein loss in the urine is also because of the diabetes. So almost if you take 100 patients of diabetes with protein loss, almost 60 to 70% of these patients, they have associated retinopathy. So for these patients, we don't need to do biopsy. Remaining 30% of patients, they might need biopsy if there is associated retinopathy is absent. This is mainly to confirm the underlying cause. If it is diabetic nephropathy, we have to treat in certain direction. If it is because of some other reason, we have to treat it differently, especially with immunosuppression. And in elderly patient, that is old age patients, especially age more than 50 to 60 years, again, in these cases, the malignancy is one more important cause which can cause nephrotic syndrome, especially the blood disorders like multiple myeloma or lymphoma can also cause nephrotic syndrome. And very rarely, infections can also cause nephrotic syndrome, like viral hepatitis is one of the most important cause, and autoimmune causes like, as I told you, SLE, systemic lupus erythematosus, can cause nephrotic syndrome, and systemic diseases, as I told you, diabetes, hypertension, and amyloidosis can cause nephrotic syndrome. And rarely drugs like even simple painkillers, which are categorized as NSAIDs, there are non-steroidal anti-inflammatory drugs. They can cause nephrotic syndrome very rarely in adults and as well as children. So nephrotic syndrome is not a benign thing, and many patients of nephrotic syndrome, they present with edema, that is swelling of body, swelling of face and feet. So they usually come to a primary physician and sometimes to a cardiologist. So be aware that not all swellings are because of the heart disease. And first remember that kidney disease to be ruled out before coming to the conclusion that is having underlying cardiac disease. So this is actually a live program. We'll see any questions asked during our live program. So somebody, Mr. Saeed Salam is asking about what is IgA nephropathy. So IgA nephropathy is a condition where, as I told you, the kidneys, they have small blood vessels which are called as glomeruli. So when these glomeruli, they get deposited by specific type of immunoglobulin, that is IgA immunoglobulin, it leads to a specific changes in the glomerular capillaries or the glomeruli. These glomeruli get damaged. They are characterized by proliferation of the mesangial cells. That is called as IgA nephropathy. So IgA nephropathy is nothing but where the immunoglobulin IgA gets deposited in the glomerular capillaries and they cause damage to the glomerular capillaries. It's called as glomerular nephritis. It is mainly characterized by some cellular proliferation, especially the mesangial cells. These IgA nephropathy patients, it is more common in young patients, usually 20 to 30 years of age, and is more common in Asia compared to the America or Western countries. It is more common in our population, and in our population, it is said that it is the most common cause of the glomerular nephritis in our part of world. So in IgA nephropathy, because of damage to glomerular capillaries, they are also present with proteinuria, but the proteinuria or the protein loss in the urine is not like nephrotic range, that is nephrotic syndrome. Usually it is less than 3 grams per day. As I said, nephrotic syndrome is characterized by more amount of protein loss, usually more than 3 grams of protein loss per day. But in IgA nephropathy, it is usually subnephrotic. That means the proteinuria is not in the nephrotic range. It is less than 3 grams per day, and they usually present with more of hematuria. Sometimes the hematuria is so severe that they usually pass large amount of blood in the urine. So they directly come to the hospital sometimes with blood in the urine, main complaint of blood in the urine. Sometimes the blood is not always red, sometimes it is altered blood. So it's like a cool drink color, Coca-Cola color. So it is classically described as cola colored urine. So these IgA nephropathy patients, they have to take proper treatment. Otherwise, this IgA nephropathy, it slowly progresses and it causes slowly, the kidney damage slowly progresses over the course of several years, and almost after 10 to 15 years of time without treatment, almost 30 to 40% of these patients, they end up in complete kidney failure, where they require some form of renal replacement therapy, either dialysis or kidney transplantation. So to prevent that progression, they have to take proper treatment at correct time to prevent further progression of kidney damage. That is called IgA nephropathy. And sometimes this IgA nephropathy, even after transplant also, it can recur. That means it can again come in the new kidney that is transplanted in the patient. That is called as recurrent IgA nephropathy. So for that also we need to treat that case if that recurs. So another person, Mr. Bashir, has asked, what test do I need? So what test do I need to do to confirm nephrotic syndrome? So as I told you, nephrotic syndrome is characterized by severe loss of protein in the urine, usually more than 3 grams per day. So the best test or the confirmatory test is to collect the 24 hours urine volume. You have to collect the total day urine in a large container, usually 4-5 liters can. You have to collect the total urine and you have to send for laboratory test to analyze for loss of protein in a 24 hours urine sample. So if that 24 hours urine sample contains more of protein, that is usually in the range of more than 3 grams per day, it is usually characterized by as nephrotic range of proteinuria. And if this loss of protein is also associated with swelling of body, low albumin levels in the blood, and also high cholesterol levels in the blood, it is called as nephrotic syndrome. So another person is asking, what are the possible causes of nephrotic syndrome? As I told you, the causes vary depending on the age group. As I told you, in children less than 10 years of age, the two most common causes are MCD, that is minimal change disease, FSGS, that is focal segmental glomerulosclerosis. General population may not understand these terms, but remember that in children less than 10 years, it is primary causes are because of the diseases affecting the kidney itself. That is, these diseases, they are limited to the kidney. They are not diseases which affect the other organs of the body. So there are primary diseases of the kidney, and the names of these two important diseases are minimal chain disease and focal segmental glomerulosclerosis in children. These patients, they usually respond to steroids, and biopsy is usually not required in all these cases. Only when they don't respond to treatment with steroids, then only they need biopsy. And in adults, as I told you, this is systemic disease, that is the disease of other means whole body, like diabetes, hypertension, can affect the kidneys in causing nephrotic syndrome. And some special disease, as I said, SLE, systemic lupus erythematosus, or amyloidosis can cause nephrotic syndrome. These are all systemic diseases. Systemic disease means disease which affect other organs of the body other than the kidneys also. And renal limited disease, that is kidney limited disease like membranous nephropathy, can affect the adults. So these are the important causes. And what are the another person is asking, what are the confirmatory tests for nephrotic syndrome? Confirmatory test, as I said, it is a quantification of protein loss in 24 hours urine sample is the most important test to diagnose nephrotic syndrome. But in children or even in adults also, the quantification or collection of 24 hours urine is difficult sometimes, because you may not collect the total day urine in a single container. You may miss some amount of urine. So in those cases, especially in children, this happens because of bedwetting or some other reason, they may not collect the 24 hours urine. So in those cases, a simple random sample and testing for spot urine protein creatinine ratio. That means it is the ratio of urinary protein to the urinary creatinine. That indirectly tells us how much amount of protein is losing in the kidney in a day. That is also an indirect marker of protein loss in a person. So if you cannot collect 24 hours urine in a single container, you can alternately choose for random collection of small amount of urine and testing for spot urine protein creatinine ratio. If it is more than 3 or 3.5, usually it falls in the nephrotic range of proteinuria, similar to the 24 hours urine sample of more than 3 grams per day. And what is the treatment options? Somebody is asking, what are the treatment options for nephrotic syndrome? The general principles of treatment, because these patients, because of loss of protein in the urine, the blood contains low levels of albumin. So they are at risk of edema because of loss of protein in the urine. There is low levels of protein, low levels of albumin in the blood. So the intravascular oncotic pressure means it's the pressure that is exerted by the albumin to retain the fluid in the vascular compartment. That is called oncotic pressure. So when the oncotic pressure drops because of low albumin levels, the fluid leaks out from the blood vessels. So there is loss of fluid from the intravascular compartment, that is from the blood vessels, to the extravascular compartment, that is outside the blood vessels. This leakage of fluid leads to the edema, that is swelling. This swelling usually occurs in the face, then legs, then usually the whole body, which is called as anasarca. So when there is low levels of protein in the blood, this is called as hypoalbuminemia. So these patients, because of the risk of malnutrition, because of loss of protein, they need to be supplemented with proteins because of excessive loss of protein. So the diet restrictions include mainly the salt restriction, because they are at risk of fluid overload. So we have to reduce the water content and also the salt content. And at the same time, you can supplement protein rich food to supplement the loss of protein in the urine. So treatment includes non-pharmacological treatment like diet, fluid restriction, salt restriction, and specific treatments include depending on the underlying cause of the disease. As I told you, in children, usually they respond to steroids. So steroids are the primary treatment for children who are having nephrotic syndrome. If they don't respond to steroids, we may need to do the biopsy, then confirm the underlying diagnosis, then treat further depending on the underlying diagnosis. In adults, depending on the underlying cause, we may need to treat the nephrotic syndrome. If it is because of underlying diabetes causing the kidney disease, we may treat it differently by controlling diabetes, hypertension, and other cardiovascular risk factors like high cholesterol levels. We have to control them. And many patients, as I told you, they are at risk of deep vein thrombosis. That means hypercoagulability. Because of loss of anticoagulant proteins in the urine, they are at risk of excessive vascular thrombosis, leading to the deep vein thrombosis like situation. So usually these patients require some form of prophylaxis to prevent blood clotting in the blood vessels. So they usually they kept on heparin followed by oral anticoagulants like warfarin or acetylene as a prophylactic therapy to prevent deep vein thrombosis or hypercoagulability in these patients. So they are at risk of hypercoagulability. So we have to prevent them. So that is also one more prophylactic therapy. Regarding specific therapies, even in adults, like some diseases like membranous nephropathy, they require some immunosuppressive treatment. Usually most of these diseases, they require steroids and some other immunosuppressive medicines. We have several classes of immunosuppressions like mycophenolate mofetil, azathioprine, cyclosporin, tacrolimus. They are all different types of immunosuppressive medicines depending on the underlying cause. And in adults, except in diabetic patients, remaining all patients, they usually require renal biopsy. And renal biopsy is most important thing which can confirm the underlying disease. And if you diagnose the underlying disease, we can start the treatment according to the underlying disease and we can follow up. And this biopsy is usually a one-time procedure. You may not repeat it several times unless some diseases which require repeated procedures, like if the patient especially having SLE and lupus nephritis, you may need to repeat biopsy. But other than that, in most of the cases, usually the biopsy is only one-time diagnosis. And if you diagnose the underlying disease, you can start the therapy and you can follow up for lifelong based on the biopsy result. In most of the cases, biopsy is required only once. That too in adults. In children, usually biopsy is not required in all the children. So next question. What are the complications of nephrotic syndrome? So complications, as I said because of loss of protein in the urine, the body or the blood protein level or the albumin level goes very low. That is called as hypoalbuminemia. And to compensate this protein loss, our liver try to produce more protein. And during this process, there are also production of more lipoproteins and cholesterol levels. So these nephrotic syndrome patients, they have high cholesterol levels, high triglyceride levels also. So this again further complicates the risk of cardiovascular disease in these individuals. And because of loss of protein in the urine, they are also at risk of infections and malnutrition. And there is also loss of anticoagulant proteins. So these patients, they are also at risk of hypercoagulability and deep vein thrombosis. So these are all the complications of nephrotic syndrome. And if nephrotic syndrome in initial stages, if it is not under control, this protein loss further aggravates, and the kidney damage or the damage to the glomerular capillaries inside the kidney, they also get worsened. This damage slowly it worsens over the period of time, and over several months to years, the kidney failure happens. So initially, the creatinine may be normal even with the loss of protein in the urine. That means creatinine is a nitrogenous waste product. It's like a poison. So normally creatinine is produced from the muscles in the human being. So this creatinine, which is like a poison substance or nitrogenous waste substance, along with urea, which is produced from the liver, both urea and creatinine gets excreted from the blood through the kidney, and in the form of urine, they get excreted from the human body. So when the kidney damage happens, or when the kidney filtration reduces, these poisonous waste products like urea and creatinine, they get accumulated in the blood, and this leads to the elevated urea level and elevated creatinine level. So in initial stages of nephrotic syndrome, where there is only loss of protein in the urine, you may have normal filtration. That means normal urea, normal creatinine levels. But if it is not under control, or if the patient does not take proper treatment, this kidney damage is slowly worsens, and the protein loss also slowly worsens, and the filtration function also slowly goes down. So this leads to the accumulation of urea creatinine in the blood. So slowly the failure features happen, and when the kidney failure reaches advanced stage, when the creatinine goes up to more than 5 or 6, usually these patients they require renal replacement therapy. To save life of the patient, they require some form of renal replacement therapy, either in the form of dialysis or transplantation. In dialysis is the artificial procedure, usually hemodialysis, where blood filtration happens through the machine, where the machine purifies the blood, where the machine removes the nitrogenous waste products like urea, creatinine from the blood. So the safe level is maintained in the recipient or the human being. In transplantation, the new kidney is put in the recipient, where the new kidney starts functioning, and where it filtrates the urea creatinine, and this urea creatinine are maintained at a normal level, similar to a normal person after transplantation. So transplantation is actually the best form of renal replacement therapy compared to dialysis. Dialysis does only 20 to 30% of normal kidney function. But if after transplantation, if they receive a new kidney, it is almost like a normal individual. The physiology is like a normal individual. So friends, don't neglect kidney diseases. Kidney diseases are usually characterized by, as I said, loss of protein in the urine, high blood pressure, high cholesterol sometimes, especially in the form of nephrotic syndrome. And these kidney diseases can have high urea levels and creatinine levels in the blood. So these kidney diseases, if you take proper treatment at correct time, in the initial stages, you can cure most of these kidney diseases. If not cure, you can at least prevent further progression of kidney disease. So, but if kidney disease goes into advanced stages, you may not have much options. You require some form of renal replacement therapy, either in the form of dialysis or kidney transplantation. So kidney failure is not equal to the loss of life or end of life. You have several advances in therapy. In the dialysis, you can have home dialysis or peritoneal dialysis, or you can have in-center, or that is hospital home dialysis, hemodialysis, or the best form of therapy is the kidney transplantation. So kidney transplantation is now picking up even in our state. Not only the live donors, where the living person donate the kidney to the affected person, even the cadaver donations, that is the dying persons who are brain dead persons, they are donating more kidneys nowadays. So the kidney transplantation is now going up very fast in our state, and in our center also we have done many numbers of kidney transplantations, and we have a good dialysis program in our hospital. So we have all forms of therapies for kidney failure patients. So kidney failure is not equal to the loss of life. So we have several options of therapy. Not only dialysis, transplantation, we have several advances in these therapies. So remember, don't neglect kidney diseases in early stages. You have to take proper treatment and proper counseling. Then it will lead to the proper cure of kidney disease. We take one more question if we have time. So what are the benefits of low sodium diet in patients with nephrotic syndrome? As I said, nephrotic syndrome is characterized by loss of protein in the urine. Thereby, they develop edema, that is swelling of face and feet. So these patients, they have excessive sodium levels or water level in the body already. So these patients are usually advised for fluid restriction and salt restriction, that is reduction of salt and fluid in the diet. So salt restriction up to 2 to 3 grams per day is recommended in these patients. So next question. So what are the tests required? As I said, the quantification of urinary protein is important, along with some other kidney tests like serum levels of urea, creatinine, electrolytes, and even complete blood picture to look for any associated anemia, and even serum calcium, phosphorus, and uric acid levels are recommended for a diagnosis and also for treatment purpose in these patients with nephrotic syndrome. So with this, we'll stop this topic. We'll we'll wind up this topic. So nephrotic syndrome is not a benign condition. You have to take proper treatment at correct time interval. If you take proper treatment, most of these cases can get cured with proper treatment. If you neglect it in initial stages, it will lead to the kidney failure. And even once the kidney failure happens also, it's not the end of life. You have several treatment options. You have to take proper treatment with the guidance of nephrologists. So thank you all. Wish you all a very happy new year once again, 2020. Thank you all.